The government has since June 9th revoked the regulation that requires the use of face masks while traveling or at public places. The revocation of the regulation is taken after COVID-19 is declared under control and the pandemic is on transition to endemic. To get better insights on the government's decision to revoke the regulation, we will be talking with the head of the Health Ministry's Communication and Public Service Bureau, Ibu Siti Nadia Tarmidzi, or Ibu Nadia. Good afternoon, Ibu. Thank you so much for joining us.
Good afternoon, Siska. Thank you.
Yes, we are very much looking forward to get more insights on this latest update of COVID-19 handling by the government. Now, Ibu Nadia, we understand that the Health Minister, Bapak Budi Gunadi Sadikin, has stated that his ministry, the Ministry of Health, has no longer specifically regulated the use of face masks as COVID-19 has turned endemic. Now, before we talk more in depth about the regulation, could you please enlighten us and give us the latest update on the current situation of COVID-19 in Indonesia?
Yeah, so I think if we flashback what happened before June, even before WHO announced that they are lifting the pandemic situation. In fact, Indonesia already tried several times to discuss and to consult with WHO regarding the situation in Indonesia. Since we aware that only United States that already lifted the pandemic situation for their country. But other countries around us like Singapore, Malaysia or other in ASEAN regional is not yet lifted this pandemic situation. So that's due to that condition. And seeing what happened in Indonesia, because the numbers that COVID-19 as are now really very quite a low number, which means that we can say the COVID-19 in Indonesia already very controlled. And that's, if we can refer to the number, yesterday, it was only like 110 new confirmation case, and the death case is only 1, and before that, it's even on 0 cases. And the bed occupation rate is 2%. We know that we have like SBB 116 that almost shocking us. We said that, oh, there is a increasing number of COVID-19 at that time. We reached around 2,800 cases per day, but it was, I think, on the second week of May, but it was decline. And there is a slightly increasing number of bed occupation rate up to 10%, and then the death case is like 20 cases per day. But this is the highest number if we seen during 2023. And we seen a different too when we have a high mobilization after 8 Ramadan. We seen like 123 million people are moving around Indonesia, and after that we don't see any increasing number of COVID-19. So that's why the government said that COVID-19 already been controlling, and then we have some step to lift it, the condition. The first one, we lifted the social mobilization, what we call it the PPKM, and now we have like a circulate letter from COVID-19 task force to start to lift the health protocol, which include the mask, the vaccination, and then how to keep the distance and how washing your hands.
Yes, of course. I think all of us in Indonesia are very thankful for all the hard work from the government and all elements of the people actually.
Yes, it's working. It's not only government, but everybody.
Everybody has worked so hard to make the situation, as you said, under control as it is now. And even, I think a lot of countries are saying Indonesia is one of the success stories in handling COVID-19, which of course we are very blessed with the development. But I would say that one of the reasons Indonesia was so successful is because of all the restrictions that we had, including the the mask restriction, the mask mandate that we have. But now that is revoked, people
Yes.
are asking, are we sure that we want to go without the mask now in public places? So I just want to make sure, you mentioned about the proclamation by the WHO that the COVID-19 is not longer an emergency of international concern, and it should not have an influence on government decision.
Yes.
Has this influenced the decision by the government to revoke the mask mandate regulation?
No, I think it depends on the country itself. So for Indonesia, while we can see so many countries already lifted this mask regulation, if we travel to abroad, we see like Singapore, US or Europe, they not currently requesting any mask again in the public activity, or even when we have in the indoor activities, only during maybe some flight travel is still implement this activity. But of course, due to the Indonesian condition, and then we seen what will be happen if there is a new variants and then there is a lot of mobilization among the community, whether it will increase the number or not. So that's why lifted the mask is the last one we are decide, because we are not just following other country. If we see, for example, like Singapore, even Singapore, they already are not wearing a mask since a few months ago. But Indonesia decided now. Why? Because we seen the experience, the situation, and the readiness of the community. Because we need to educate the people. Although later we will lift it the emergency situation or the pandemic situation in Indonesia, the COVID is still there. They still can mutation, they can still infect it, and they still get people to get sick or even worse. So that's why we still impose this policy.
Okay, you are right, Ibu Nadia. A number of countries have abolished regulations requiring people to wear masks much early on than Indonesia. Singapore has implemented the no mask policy since August last year in 2022. South Korea since early this year, early 2023, no mask in public setting except public transportation. And Japan just recently, I think in March or April 2023. So you explain why Indonesia took its time to implement this no mask, because we needed time to educate people. So maybe you can tell us more now that the regulation is revoked. What are we educating people now? What are we advising to people, especially to people that we think should still wear masks, although there is no mask mandate?
So of course, the first thing, the current policy that we are imposing to the community is now, this is your individual responsibility to prevent yourself and your family from COVID-19. So that is not like what we have during pandemic, when the government are really taking a lead on how to prevent, how to make sure everybody is safe. Now you yourself and you're to taking care yourself and your family. So that's why in terms of revoke the mask, currently what we are saying that it's allowed not to use mask, but you have to decide whether you are sick or you are not sick. That's the first one. And the second one, whether you have a risk to be infected or not infected, or you have a risk to infect other people. So those things need to be decided by individually, so they know. And of course, we say that if you have like influenza symptoms like coughing, sneezing, or fever, you have to wearing a mask, because we know if we are sick, it means our condition is not really in the best situation. So you might infect other people, or you will get infected by other people that might potentially getting worse your disease. So that's why this education that we ask the community that you are allowed not to wearing a mask, but remember, when you have symptoms, it should be better you are wearing a mask. That's the first one. And then if you are having activities outside and you have very high pollution, I think it's better you using mask. It will prevent you from getting any diseases.
Okay. So from government mandated, it now has become our own individual responsibility. And we should have the discretion to decide what is best for us and also for the people around us.
Yes, right.
Okay. I would love to talk more about this, but before that, I would like to go on to our next report first, Ibu Nadia, if you don't mind. We continue with the next report as Indonesia moves closer to treating COVID-19 as an endemic. A number of public transportation made in Jakarta, such as the Trans-Jakarta bus service and Mass Rapid Transit, or MRT, have now allowed people to remove masks on board.
The Jakarta Transportation Office has issued Circular Letter number 26/2023 on health protocols in public transportation during the endemic transition in the Jakarta area. Trans-Jakarta bus service and the MRT have now allowed the public to remove masks while on board. However, passengers are still urged to protect themselves from possible COVID-19 transmission. Those who are in unhealthy conditions are still encouraged to wear face masks. In the meantime, commuter line operator PT Kereta Komuter Indonesia still requires passengers to wear masks during trips on the rail train or KRL. Spokesperson of Kereta Komuter Indonesia, Leza Arlan, said the rules for boarding the train remain the same. She added the company is still waiting for confirmation of the new regulation which relaxes COVID-19 restrictions. In addition to require passengers wearing masks, KRL still imposes the vaccine policy as a condition to get on board the train.
We are now back to our talk with the Ministry's Communication and Public Service Bureau, Ibu Nadia. We've been talking a lot about the latest update in the COVID-19 handling. We are now entering a new era. Yes. COVID-19 is under control, thank God. And we are now moving on to the phase where the community, the society can actually take individual responsibility in ensuring their safety and their health and also the people around them.
Yes, right.
Face masks are no longer government mandated, but doesn't mean that you no longer need it at all. It depends on your situation. So I would say maybe this is the trickiest part of this new era, Bu Nadia, to ensure that people understand there are certain circumstances where they should wear a mask in public. How can we convey this message to the public?
Yeah, so that's why we are doing this, what we call it, revoke the policy is step by step. Currently, if we seen in the circulate letter, we are not talking about the pandemic situation. We already mentioned this is the transition of endemic situation. So it means that we really already closer to that situation, which means now you have taken care of yourself. You have to know whether you need a protection for yourself and your family. And of course, a mask is not a mandate everywhere. We've seen that previously, in outdoor activity, we are allowed to have not wearing a mask, but still in indoor activity or in the crowded situation or even in the public transportation, it's still need to be wearing a mask. But currently, of course, we are allowed not to use it. But remember, we need to protect ourselves. That should be the education that we would like community know and notice about this.
Okay. So just to repeat again what you said earlier, a person should wear a mask when he goes outside, especially to public settings, if they feel sick, if they are sick, if they think that they have the risk of getting infected or vice versa, infect other people, then yes, definitely you should wear a mask. Now, maybe you could also give other reasons for recommending the people to still wear masks currently now in today's climate.
We've seen that previously, like in Japan, usually people in Japan are wearing a mask if they are doing something outside activity because they are concerned about the pollution, about the quality of the air. And this is the situation where the big city is facing. If we seen the pollution quite high in some cities, of course, like Jakarta, Bandung, or Bogor, or even surrounding Jakarta, like Bekasi or Depok. So that's why we know that the pollution is one of our threatening issue, because of course, some pollutants are making us sick, and then it trigger us to get disease like influenza or something. So that's why wearing a mask is not only for COVID-19, but to prevent all others. And the other thing is, we know that in the circulate letter, we are mentioned about washing hands. Don't forget, although now we are not saying that you need to washing hands everywhere, but we still encourage people to bring like hand sanitizer, or if you just touching any things that many people are touching it, so it's better you washing your hands. So those two things, in fact, wearing a mask and washing your hands, it's a good practice in health to prevent any disease. Is not only COVID-19.
It's actually probably the easiest way to ensure our safety and health from diseases.
Yes, right.
Okay, Ibu Nadia, you mentioned before that although we have COVID-19 under control, we cannot say that it is completely gone. Actually, it's still among us. You said it before, although it's highly decreased, only 110 cases last time, only 2% bed occupancy in hospitals, but it still exists. So maybe you can tell us what policies or measures that the government are taking right now to further control and further reduce the spread of COVID-19, and how should the people stay safe from COVID-19 virus that still exists?
Yeah, first we know we cannot directly eliminate this virus. We can win the battle like the current situation that we have. Many people get infected, but they don't have, in fact, symptoms. And then if they have symptoms, it's very mild. And then the duration of the illness is become shorter. You know that previously we have like 10 days, 14 days until we get negative in laboratory result. But now it's like 3 days, 5 days, it's already become negative. So, so we know that the virus is getting weaker and weaker, but still they can infect us, and especially for elderly and people who have comorbid diseases like hypertension, diabetes, or they have like heart disease. They need to control this disease, because these diseases are very high risk factor for fatality of COVID-19. So just keep on remind us, there is still COVID-19 around us, there's still mutation, but we have now strong community protection because of the vaccination. But still, we need to be aware of this.
Okay. Ibu Nadia, thank you so much. Our talk has been more than insightful.
Thank you.
Very happy to have you here. And please send my best regards to everybody at the Health Ministry. Thank you for the hard work on taking control of the pandemic and making it to endemic. Hopefully, we can now live our life more freely and be a better contributor to the society. Thank you, Ibu Nadia.
Thank you.